Good evening, everybody. Welcome to The American Dream. My name is Jim Carrigan. I am the host of this show, and today we're going to be talking about the Lynn Community Health Center, in particular, the Behavioral Health Unit of the Lynn Community Health Center. The health center at the present time is one of Lynn's great institutions. It treats about 35,000 Lynn people. Dr. Mark Alexakos is the Chief of Behavioral Health. And to his right is Milay Lemos, who's a mental health counselor. And to her right is Maria Baldrich Valerio, who's also a mental health counselor. We're going to be talking today about sexual abuse and domestic abuse. As you know, we had a conference in City Hall here last spring on sexual abuse. And, teach people how to deal with sexual abuse. One of the things we're trying to relate to people is, where do you go for treatment if you need treatment as a result of sexual abuse? This is a prime place to go. So, Doctor, welcome to the show.
Yeah, thank you so much. We really appreciate you inviting us to be here. Unfortunately, childhood sexual abuse and intimate partner violence, it really is a national health crisis. 1 in 4 women experience some type of childhood sexual abuse. 1 in 4 women may be in a domestic violence situation. For men, upwards of 1 in 6 may have experienced some form of sexual abuse. So it's a real national health crisis that needs a lot of attention.
Okay. Introduce yourself. Tell us.
My name is Milay Lemos, and I'm a mental health counselor with Lynn Community Health Center. I work with adults aged 21 and up, and most of my patients are Latino and Hispanic. Domestic violence and sexual abuse are problems that come up for most of the patients that I work with. So it is a real crisis, and it's something that continues to impact the individual well into adulthood.
Okay. Maria?
I'm Maria Baldrich. I also work at the clinic as a mental health counselor. I work with individuals and I work with families and children, specifically families have been suffering domestic violence, and the impact on the children is really high. So we try to help the families to get through that.
So you work primarily with children?
No, with adults and children.
Adults
Families, yes.
Okay. So what do you do when somebody comes into the center and says, my child was abused by, sexually abused by an adult?
Yeah, I think, always the first step is we try to create a welcoming and friendly environment. I mean, these are very difficult things for people to talk about. And so what we want to do is sort of build trust. And many people come in and talk to us about things, and they need to understand we're very professional, and we'll take a history, understand the situation, and understand the impacts.
Okay. And they end up in a group with you, or you?
Yes, they end up either in individual counseling or group counseling, depending on each case, what is more appropriate for the case. Yes.
Okay, so you do a mental health workup, right?
Yeah, so they'll come in they'll come in and meet with Maria, and hopefully just like this conversational, we'll sort of ask a little bit about, what's going on in your life, ask some open-ended questions, what are your concerns, and, as they sort of talk to us, we might ask some more specific questions. How has it impacted your life? What else is going on in your life? Who are your social supports? We really try to focus on strengths, and we want to understand an individual so we can intervene in the most effective way to help them move forward.
And you form a diagnosis, right?
Yep, absolutely.
And some of the diagnoses?
Yeah, I mean, I think common types of diagnoses are post-traumatic stress disorder, depression. Sometimes there's an adjustment reaction. It depends. Sometimes we're seeing patients who come in and say, I've had abuse in the past, or if it's a brand new situation, where they say, this is actively ongoing, my child is being sexually abused, or if somebody comes in and says, I'm being abused by my partner, we always do a safety assessment. Safety is the top priority, and to be able to treat somebody who's being abused, you always have to stop the abuse. But that creates a lot of fear for people.
So post-traumatic stress disorder is not simply, it's never simple. It's not something that just comes from being exposed to a war. It can also be caused by sexual abuse when one is a child. Is that correct?
Yep, absolutely. So post-traumatic stress disorder, it's a clinical diagnosis, and it's a constellation of anxiety or bad memories or reliving experiences, and it can come from multiple forms of trauma. But basically you have all of these symptoms to such an extent it impairs your functioning day to day.
So sometimes the abuse can happen when a person is, say, 7 years old, and they repress it, and they really don't deal with it for another 20 years or so, and then they get into an accident or a car accident or some kind of crisis in their life, and it manifests itself again. Is that right?
It actually presents itself in many ways. It can affect
Okay.
people differently throughout their lives. But certainly
Okay.
what we do know, new traumas sometimes re-trigger old traumas, and I don't know if our experts here want to talk a little bit about that
exactly.
from
Okay,
from
good.
their work. Yeah.
Yeah, so that's the way sometimes that you notice that there was an incident in the past when there is a new thing going on in the life, and sometimes adolescents, they come with behavioral problems, and that's when you notice that things happen.
Okay.
And never the adolescent had the chance to work through that incident of the past.
The second incident doesn't have to be related to the first
No,
incident,
it doesn't
right?
have to be related. Sometimes
It could be a car accident,
yes,
for example.
yes.
Yeah.
It's the reaction, the body reacts in a way that mimics the same reaction. So when we do the evaluation, we explore all the whole life, like the developmental and what happened. So
Sometimes stress doesn't have to be another trauma. It could be
Yes,
like they've lost their
yes.
job, some stress brings it out, or some family member says, oh, this happened to my child, and they remember, oh yeah, that happened to me, and brings up symptoms and distress.
Now, people don't walk in to your office and say, I'm suffering from PTSD, will you help me out, right?
no.
It sometimes takes a long time to learn about it. Is that-
Absolutely, and I think also, for children, sometimes children don't tell you this is going on, and I like to say sometimes kids present sad, mad, anxious, withdrawn, and sometimes all the adults can't sort of figure out why that is. But I think if you have concerning things that are going on with your child, it's important. There's help out there, and it's easy to get.
And they learn about PTSD when they are in counseling. That's one thing that we do a lot, the psychoeducation. So when the person learn about what is going on in my life, why I'm reacting this way, later on it's easier to deal with other stressors.
Okay.
There's also an important distinction between post-traumatic stress disorder that happens after a single traumatic event and post-traumatic stress disorder that happens after ongoing events that have been
yes.
traumatic for the individual. So typically when there's childhood abuse has taken place, it's in the form of ongoing events, so it's trauma
Right.
that occurs over time. And in the future, that can impact the way that that individual is in relationship with others. So looking at the individual in relationship becomes important.
And she brings up a good point. There's a whole science around what we call attachment, but that's one of sometimes the most profound effects of abuse. People don't trust other people. They have trouble forming sustainable relationships where they can feel healthy, loved. They have a lot of anxiety, mistrust, worry, and sometimes they can't even express it, but it just happens in their life that they struggle forming good, solid relationships.
So what are the symptoms that you see when you're in group?
So with many of the patients who I work with who present with post-traumatic stress disorder, some of the symptoms are hypervigilance, being always in a state of alerts, looking out for danger. Flashbacks are also common, so when something triggers a memory, perhaps seeing a certain individual or having a certain conversation, they might feel like they're in the situation of abuse all over again. So those are two that I see quite frequently.
Okay.
And those symptoms are many times are seen by other, like the members of the family members. So the person suffers from hypervigilance, meaning that is in other relationship it reacts in a way that is way more than it's supposed to be, but for the situation. So the person doesn't know how to react normally, and certain amount of stress reacts higher than is expected.
So, go ahead, Mark.
Yeah, so we know it's our bodies normally have an alert system, and it makes sense. So if there's danger, we try to avoid it. And if you've been in a lot of danger, your body just activates that system. So sometimes it's just triggering all the time. And other people don't understand it, but people who have PTSD, they understand it very well, that they're constantly on alert or constantly anxious or over-aroused.
So how do they deal with it? How do people cope with this?
One of the things that I do in my practice is teaching them skills to self-care. Self-care is a big thing to deal with any traumatic experience. And many people who have experienced trauma, they just tend to not care of themselves, like meaning resting, taking time, spending time with the family. So increasing self-care is one of the things that is very important to deal with PTSD. And doing any activities that you enjoy in life. Some people, they just stop doing the things that they like to do, like reading or playing or doing swimming. There are many things that that person used to do in the past and stopped doing it. So going back to enjoy activities is one of the ways that people deal with that.
When you say self-care, what do you mean by that?
Self-care, we have human beings, we tend to care for other people or care for anything, care for the job. But taking time for yourself, resting, playing, doing things for you, enjoying yourself, that's what I mean with self-care.
Okay.
Yeah.
And so unfortunately, sometimes when we experience trauma and we haven't received the support that we need yet, we might go to unhealthy coping skills. Sometimes that can be substance use or other harmful behaviors to the self. So one of the ways that I try to work with patients is identifying some of those unhealthy coping skills, validating them, which is important, letting the person know that this is the way that they've been trying to manage a stressful situation, but then thinking about how we can substitute those unhealthy coping skills for healthy ones, how to regulate emotions when they come up with healthy coping skills.
And in certain cases, medicines can help. So if you have severe anxiety, or there's medicines that can help nightmares, if people have that at nighttime, bad dreams. So, a whole package of treatment can certainly significantly reduce symptoms, and in some cases really turn somebody's life around. And so that's the good news.
So is there a time, I know every single case is different, but is there a time period as to how long somebody would be in treatment at the health center for?
Yeah, it can vary. On average, people come in for about 11 sessions, but it could anywhere be 6 sessions, and in lots of cases, sometimes they do a more intensive work, 20, 25, 30 sessions, and then they come in once a month just to kind of maintain that they're doing better. So everybody, we tailor it to the individual needs, their life, and how they're doing and how they're progressing.
And what is a session? That's a meeting with one of the mental health counselors?
Mm-hmm.
Okay.
It can be meetings, it can be like group sessions. So, and it depends of the person also, on the complexity of what trauma was, for how long it's going to take that person to go back to the previous state, or if it's going to take a month. Sometimes some people, they just learn quickly, and I get surprised in 4 sessions. Oh my God, I'm doing better, which is a good thing. Other people it might take years to heal.
Typical sessions, either a half hour or 40 minutes. Typical group therapy is 50 minutes or so, or an hour.
If somebody suffers from social anxiety, you probably wouldn't put them in a group session. Is that fair to say? Or?
Oh, well, social anxiety, being in a group, it's not gonna, sometimes it doesn't work. Like they fear even the same event of being in a group setting. So the beginning of that treatment will be individually. Once they are getting some steps, they might join a group and learn other skills. So the beginning of social anxiety can be more individual work until that person feels ready to face a group.
What about agoraphobia? How do you deal with that? What is it, first of all? Who wants to define that?
Sure. So
Milay.
So agoraphobia typically presents in terms of an individual being really afraid to leave their house. So the home is one of the settings that's pretty common. This can be quite challenging to get the individual to come to therapy because they experience a really high level of anxiety when they do leave the home. So in terms of the work that I do with patients who present with agoraphobia, a lot of it is around how to manage the anxiety that emerges when they do leave the home.
And sometimes for children, they refuse to go to school, they have such anxiety, and again, it's about that evaluation, because some children are just naturally anxious and it's not related to trauma. Sometimes there is trauma, so individualizing, understanding what's going on with the person and trying to intervene. Fortunately, there are wraparound services for kids, so there's readily home-based services. Also, kids can get like a therapeutic mentor, somebody who's trained to deal with a child who has anxiety or trauma, but does pro-social activities with them. So there are resources available.
Okay. Do you use Suboxone at the clinic for somebody who has a problem with drug abuse?
Yeah, absolutely. We have availability, for what they call medication-assisted treatment, and Suboxone is the main medicine we prescribe. There is methadone available through Hypervigilance and other organizations, but those are the two mainstays of if you need to be on something to prevent heroin use. And so we have about 400 people. We have a large clinic, and again, accessible services. We're here to help. There's group therapy. You also get individual therapy. You don't just get the medicine. So again, we give you a whole package of help so that you can succeed.
Do you try to get people to stop their abuse of drugs or alcohol without medication, without Suboxone?
Again, it's sort of individualized,
Yeah.
and some people feel like they can make a try at that, although we do know that there's a high failure rate without medication-assisted treatment. But again, you have to look at each individual. If you look at statistics, people tend to do better with Suboxone if they have a longer-term history of opiate use.
Okay. So let's go back to coping skills for a minute. What about anxiety? Somebody described the symptoms that one has when one suffers from anxiety.
Well, sometimes the anxiety is easily seen or felt by the person as shakiness, feeling like jumpy or feeling that something wrong is going to happen, heart racing, and the social refusing to go out. Sometimes that's anxiety. And the same PTSD is a type of anxiety disorder. And the way we manage anxiety, the primary thing is learning relaxation techniques.
For example?
For example, breathing techniques is the main thing I teach my patients. The first time that I teach the simple breathing techniques, sometimes we stop breathing or breathe too slow, and then the anxiety goes too high. So there are other techniques that I use. Yoga, stretching exercises, meditation. So that's the main thing, using relaxation techniques in general. And there are also medication when the anxiety is too high that is not easily controlled, then medication is another way. Okay. And also working through whatever went on that caused the anxiety, and in individual therapy. Or group therapy also. We have group therapy for that.
Okay.
Yeah.
What about depression? What is depression? Who wants to talk about it?
Well, I don't know.
Sure.
Milay?
So depression, we typically see depression as a constellation of symptoms. The loss of interest in activities or doing things that we used to like to do, the loss of pleasure in everyday things that used to make us feel good, irritability. Anxiety is actually also one of the symptoms of depression. Feeling blue, a desire to not get out of bed. Sometimes it can look like a loss of hygiene, so loss of motivation to care for oneself. So all of these are symptoms that are very typical of depression. And sometimes there can also be suicide ideation, which it's something that we can work with in therapy as well.
Is that primarily associated with depression, suicide ideation?
It's quite common in patients who are presenting with depression. I think that it depends on what other stressors are in that person's life, and also what other support systems there are in the person's life. But I think when we look at more severe cases of depression, suicide ideation becomes more present.
It also can be present in other conditions.
Okay, so when the health center came to Lynn back around 1971, most people would not talk about mental health. I mean, they would never come to you and say, I'm depressed, especially men. It was just, you know, I'm a man, I don't get depressed. That's clearly changed now, is that right? I mean, it's something that people recognize as a disability, and they're willing to treat with it. Is that fair to say? Or?
Yeah, I would say there's still some stigma, but the good news is it's much less. I mean, I think shows like this help.
Yeah.
But you know, we see probably about 10 to 15% of the people at the health center who get primary care in behavioral health. If you look at statistics, about 25 to 30% of people may have some mental health condition. They're not all severe, but from all the way from anxiety to, like we've been talking about, post-traumatic stress, or unfortunately some people have a couple things going on, PTSD, depression, substance use disorder. But the good news is we can manage that here at the Lynn Community Health Center. We have over 70 therapists, we have 30 group therapy options running at any one time. We have the medication-assisted treatment. So
How many therapists do you have?
we have over 70.
Wow.
So there's services available, so people should seek them out.
Where are you based?
So we have a couple locations. So we have, what's nice about the Lynn Community Health Center, all the primary care teams have therapists integrated. We're known for integrated health, so therapists are working side by side with their primary care doctors. We also have at 20 Central Avenue, 2 floors of behavioral health. At Western Avenue and Market Square, we also have a small clinic, and we're also in 13 of the Lynn Public Schools. So we have a range of services available.
What do you have at the Market Square office? Do you have mental health services there as well?
We do. So we have a team of behavioral health therapists, and we also have prescribers, so a psychiatric nurse practitioner and a psychiatrist who do medication treatment for patients.
What do you do with the schools?
Yeah, so the schools, in 9 of the schools, we both have medical services and behavioral health services side by side, and so we work with parents and teachers. And so for kids who have been identified with some type of problem or issue, again, just like the central clinic, we meet with the parent, get an understanding of what's going on. All services are voluntary, and so if the parent feels like they want their child to get services, we'll go ahead and we can provide therapy in the schools and evaluation.
That
In the
happens
school, yep. And the other 5 schools have behavioral health. It's very convenient. They don't have to come over in the evening.
Right.
They can get the services right where they need them. So it's actually a wonderful model. And then we can work with the school system on prevention, trying to build strengths and support teachers.
Fantastic. Okay, so what else do you do?
Well, we do.
Did you want to talk a little bit about the child-parent therapy for?
We work with HOG. I work with HOG, and we have a program called Child Parent Psychotherapy, and we work with this family, the unit, the mother and the child, specifically helping them overcome whatever consequence the domestic violence had, specifically with the children who show behavioral problems, emotional, social difficulties that has been directly the cause of domestic violence. So we help this mother or this father to help the mother to help the child to learn skills to overcome that situation.
It's an innovative approach, because before the mother would get therapy separate and the child would get therapy, so they get therapy together, so they can learn from each other and learn coping together.
Do you work with HAWK?
Yes.
Okay. You refer people to HAWK?
Yes, we do.
And they refer to you also?
And they refer to us also, yes.
Good.
And we have this program that is in collaboration, we do it together. So HOG, we work for the clinic, but we work with HOG.
HAWK is Help for Abused Women and Children.
Yes.
Okay. If one is suffering from domestic abuse, where would one call or go to deal with it? Can they go to the health center?
Yes. You can go to the health center. We can call the hotline. There's a national hotline. There is a hotline for HOG also that you can call. You can talk to, if you have a therapist, you can talk to the therapist or the primary doctor. Or if you go to a church, sometimes you go talk to the pastor. So asking for help with somebody that you feel is going to be confidential. And at the clinic, that's something that we promise. And that's the big.
You're worried about a situation that you're in, whether it's domestic violence or you're worried about sexual abuse going on in your family, you can always go to your primary care physician or to the child's pediatrician and start there. If you don't know where to turn, you can always start with that person. But you can always call the health center. Both you can, request a referral online yourself. You could call, but you can always start with your primary care doctor to get some help and support.
Okay. And you provide primary care doctors as
absolutely.
well.
And like I said, at Lynn, they're working side by side. So if you present a problem to your primary care doctor at the Lynn Community Health Center and they'll ask you, do you want to meet the therapist right now? They'll get the therapist, do an introduction, and then get you started.
Okay, we're going to have to wrap this up in a minute. So do you have any advice for our viewers as to what they should do if they have any of these problems?
Ask for help and seek help. One big thing with sexual abuse and domestic abuse is that the person feels that it has nowhere to go, or if the person feels that he's going to be told whatever situation happens. So we promise confidentiality. So if you ask for help, you're going to get help, and nobody's going to know that. So.
Okay, so I want to thank you all for coming on the show. You did a great job. Did you have fun? Yeah. Good ad for the health center.
Yeah, thank you.
Yeah. Well, I think it's a big service to people to learn about the things you were talking about.
Yeah, it's a
because
whole
you don't often get that opportunity in life. So, okay, so thank you.
You guys did good. I'm proud of you guys.